So after having discussed about the enzyme inducers, now let me discuss about the enzyme inhibitors, right? So let me discuss about the enzyme inhibitors, right? Enzyme inhibitors. Now you see here, enzyme inhibitors will decrease the metabolism of the drugs, whereas enzyme inducers will increase the metabolism of the drugs, whereas you take the enzyme inhibitors, they will decrease the metabolism of the drugs, right? They will decrease right? Enzyme inhibitors will decrease the metabolism of the drugs metabolized by the microsomal enzymes, right? Will decrease the metabolism of the drugs metabolized by microsomal enzymes. Okay, now so what I want to tell you here is, now once these enzyme inhibitors, once they inhibit this particular microsomal enzyme, the metabolism of the drug is decreased, and this will predispose the toxicity of that particular agents. So thus this predisposes to the toxicity of the drugs or the agents. Okay, now let me tell you the drugs which are acting as the enzyme inhibitors, right? What are the drugs which will inhibit this particular microsomal enzyme? Now if you take the inhibitors, right, if you take this particular inhibitors, these inhibitors, they include ketoconazole, right? The inhibitors, they include ketoconazole, and then you have cimetidine, right? Then you have cimetidine, then you have erythromycin, right? Then you have erythromycin, and then you have metronidazole, right? Then you have metronidazole. So ketoconazole you take, it's an antifungal drug, and you take cimetidine, it is the drug which is given in patients with the peptic ulcer, which is nothing but the histamine receptor antagonist, and erythromycin, which is an antibiotic, which is a macrolide group of antibiotic, and metronidazole, it's an anti-parasitic drug. Okay, now these are the enzyme inhibitors. Now if you take these metabolic reactions, remember metabolic reactions may be classified into two phases, that is phase 1 reactions and as well as phase 2 reactions. Okay, so if you take the metabolic reactions, these metabolic reactions, right, these metabolic reactions, they may be classified into phase 1 and as well as phase 2 reactions, right? They may be classified into phase 1 and as well as phase 2 reactions, right? Phase 1 and as well as phase 2 reactions. Now you take phase 1 reactions. The phase 1 reactions, they are non-synthetic, right? Phase 1 reactions, they are non-synthetic, whereas you take phase 2 reactions. Phase 2 reactions, they are synthetic, right? Phase 2 reactions, they are synthetic reactions. Now you take the function of the phase 1 reactions. Remember, the function of the phase 1 reactions is to attach a functional group to the drug molecule, right? In phase 1 reaction, it is the functional group. So what does the phase 1 reactions will do? They will attach the functional group to the drug molecule, right? They will attach the functional group to the drug molecule. Whereas you take phase 2 reactions. Phase 2 reactions, they are to serve, right? They serve to attach a conjugate to the drug molecule. Okay, so here phase 2 reactions, they serve to attach the conjugate to the drug molecule. Alright, next. Now what I want to tell you here is, now in phase 1 functional group is attached to the drug molecule, in phase 2 conjugate is attached to the drug molecule. Now after these metabolic reactions are over, right, that is after phase 1 reaction, what will happen to the drug? Remember, after phase 1 reaction, the drug may be water soluble or lipid soluble. Okay, so after the phase 1 reaction, the drug may be either water soluble or lipid soluble. Right, the drug may be either water soluble or lipid soluble. Now you take phase 2 reactions. Remember, after phase 2 reactions, all drugs become water soluble and lipid insoluble. Okay, so remember, after phase 2 reactions, all the drugs, right, all the drugs, they become water soluble and they become lipid insoluble. Right, they become lipid insoluble. Now let me tell you what are your phase 1 reactions, what are your phase 2 reactions. So before going into further part of the types of metabolic reactions, let me give you a mnemonic for the enzyme inhibitors. Enzyme inhibitors I have said you, that is ketoconazole, cimetidine, erythromycin and as well as metronidazole. There are some more drugs which are the enzyme inhibitors. Let me tell you. The enzyme inhibitors, the mnemonic is vitamin K cannot cause enzyme inhibition. That is a mnemonic, right? So the mnemonic is vitamin K vitamin K cannot cause enzyme inhibition. Alright, this is a mnemonic. Right, mnemonic for what? Mnemonic for the group of drugs which are the enzyme inhibitors. V stands for valproate. Right, and valproate, it's an anti-epileptic drug. And you take K. K stands for ketoconazole. Right, K stands for ketoconazole. The word C stands for cimetidine. Right, the word C stands for cimetidine. The word other C stands for ciprofloxacin. Right, the word other C stands for ciprofloxacin. The word E stands for erythromycin. Right, the word other E stands for erythromycin. And the word I stands for INH. Right, the word I stands for INH, that is 𝐼𝐶. Okay, so these are your enzyme inhibitors, that is valproate, ketoconazole, cimetidine, ciprofloxacin, erythromycin and as well as 𝐼𝐶. So now let me tell you the types of metabolic reactions. Right, I have said you it is phase 1 and as well as phase 2 reactions. Now let me tell you what are phase 1 reactions and what are phase 2 reactions. Right, so if you take the metabolic reactions, the metabolic reactions, they include phase 1 reactions and they include phase 2 reactions. Now, what are all your phase 1 reactions, right? Phase 1, it includes both microsomal and as well as non-microsomal, right? It includes both microsomal as well as non-microsomal, right? As well as non-microsomal. Now, what are your phase 1 reactions? Remember, they include oxidation, right? They include oxidation, right? What are all your various oxidation reactions? In that we have hydroxylation, right? In this we have hydroxylation. Then we have what is called as dealkylation, right? Dealkylation. And next what we have is deamination, right? Next what we have is the deamination. So these are all various oxidation reactions. And you take the apart from oxidation, the other reactions include reduction, and next to the reduction we have what is called hydrolysis, right? We have hydrolysis. So these are all your phase 1 reactions, alright? Now you take phase 2 reactions. So if you take phase 2 reactions, they are again microsomal and as well as non-microsomal reactions, okay? So these are your again microsomal right? Apart from this microsomal, we also have non-microsomal, right? We also have the non-microsomal. You take the microsomal reactions. The microsomal reactions, they include glucuronide conjugation, right? They include glucuronide conjugation, right? And glucuronide conjugation, remember, this is a multiple choice question. Most common phase 2 reaction is your glucuronide conjugation, right? So this is the most common phase 2 reaction, right? That is your glucuronide conjugation. Now you take the non-microsomal enzyme system, right? What are your phase 2 non-microsomal enzyme reactions is, they include glutathione conjugation, right? They include glutathione conjugation. Next to the glutathione conjugation, the next include acetylation, and next is your methylation, right? Next is your methylation, and then lastly you have what is called sulfation, right? Lastly you have what is called sulfation. So these are all your non-microsomal phase 2 reactions, alright? So let me summarize the metabolic reactions. The metabolic reactions, we classify them into phase 1 and as well as phase 2 reactions. Phase 1 reactions, they are non-synthetic reactions. Phase 2 reactions, they are synthetic reactions. In phase 1 reaction, the functional group is attached to the drug molecule, and thereby the drug will either become water soluble or lipid soluble. You take phase 2 reactions, they are the synthetic reactions. So here the conjugate, it is attached to the drug molecule. So once the conjugate is attached to the drug molecule, then the drug becomes completely water soluble and it becomes lipid insoluble. Next, you take the types of metabolic reactions that include phase 1 and phase 2. In phase 1, wherein both microsomal as well as non-microsomal, the types of metabolic reactions are oxidation, reduction and hydrolysis. Oxidation is again like hydroxylation, dealkylation and as well as deamination. And you take phase 2 reactions. Phase 2 reactions, we have microsomal and as well as non-microsomal. You take the microsomal. Microsomal phase 2 reactions, they include glucuronide conjugation, and this is the most common phase 2 reaction. And you take the non-microsomal. Non-microsomal include glutathione conjugation, acetylation, methylation, and as well as sulfation. So these are the types of metabolic reactions.